Listen, I got this patient coming in. Y'all, when I say I dislike, with a passion, I dislike this patient. His appointment's at 10 o'clock and it's 10:03. A part of me is like, I don't want him to show. But a part of me is like, come on in here so we can get this over with. He has been a pain in the rear since I met him in December of 2020. He was one of my very first patients that gave me problems. And ever since then, it's just like, he's just so difficult for no reason. Thankfully, I know how to talk to people and handle them. So he knew not to come at me. But I just want him to come in so we can get this over with. Just get it over with. That lets me know he here. God, dog. I'll keep you posted. Okay, so I'm back. That was an hour. He's one of those patients that you just cannot please. You just can't please. He's uncooperative. He don't. So he comes in the room. I have him put, we only doing one contact, right? Only doing one contact. So he comes in. I said, all right, you know, I got my energy ready. I'm happy, bubbly, because I have to prepare myself for him. So I said, all right, let's go ahead and pop this in the right eye. He said, well, I don't know how that's going to be because I can never get it in. I mean, I don't even know why I'm doing contacts. I said, well, you know what? Let's try again. Let's just go for it again. You got this, friend. You got it. Like, he's just so negative. I mean, he complained the entire exam. Like, I just don't understand. They're working on everything else in the world. Why can't they come up with a solution on how to fix eyes? Sir, they have. It's just your eyes just don't. You just not a candidate for certain surgeries. That don't mean ain't nothing been invented. Then he started talking, well, you know, the AI's coming out and da-da-da, and I work for IBM and blah, blah. I'm like, sir, I don't care about none of that. Ish. Get this contact in your eye so we can go on. Then he started complaining, and then he started bashing his parents, which he does that every time he come in. My parents just did not take care of me very well. They just didn't give a F about me and da-da-da-da-da, and I just didn't care, you know, about my eyesight, and they just let me go blind. No, they didn't. No, they didn't. I can tell you were the problem. You are. I said, let me watch your technique. Let me watch your technique. So he get in there and he's like, oh, I just can't do it. This is why I just don't want to do contacts. I said, let's slow down. Let's take a breather. I said, don't get frustrated, friend. Don't get it. Don't get frustrated. I said, let me watch and see what you're doing. I said, you see what you're doing? You're forcing it in your eye. I said, just gently tap your eye. I said, when you do it, kind of look down and release your finger up. What happens? He listens to me and he does it. And the contact gets on his eye. He said, oh, wow. Listen to me, baby, because I got a good successful rate. So he puts it in. He does this. Oh, I can tell you right now something's not right. Sir, give it a second. It ain't even been 10 seconds. That has been on your eye. So I turn on the eye chart, and he's like, oh, this is blurry. Oh, I can't. This is not, I won't be able to do this. I said, Mr. So-and-so, give it a moment. I said, if there's something wrong, I said, I can tweak it. That's what we're here for today. If there's something not right, I'm going to tweak the prescription. So he complaining it's blurry. All right, I said, let me tweak it. Take it out. Go ahead and take it out. So I said, let's try a different route. I said, let's do this monovision. Let's see how you do it. Put in the monovision. Oh my God, this is way worse. I said, okay, hold on. Give it a minute. I had to explain to him what monovision is. So he was like, yeah, this is going to work. I said, well, let's check your near. He loved the way it looked up close. He said, oh, this is sharp. I love this, but my distance. I said, okay. Let me tweak it one more time. I said, let's try putting something in this left eye. Well, you know, I can't really da-da-da-da on my left eye. I said, I understand. I said, but let's try it. Give it a second. So he trying to put the contact in his eye. He getting so frustrated. He was like, I'm done. I just don't want to do this no more. I said, take a breath, Mr. So-and-so. I said, it's okay. I said, you did great on your right eye. I said, just take a moment with your left eye. I said, you can do it. You can do it, friend. What happens? He does it. So we got the contact in, all right, checking his vision. He's like, it's still off. He said, my up close is great, but my distance. I said, okay, let me tweak it one more time. I said, I think this last time it's going to work for you. He said, okay. All right. So in the meantime, he doing this. Oh, it's burning. It's burning. It ain't burning. It ain't. You just being dramatic. But I said, you know what? It might be your allergies. You might got dry eyes, sir. Maybe that's why it's burning. I said, let me put some drops in your eye to help relieve that. So we tried one more last thing. Right eye only. Nothing else in the left eye. Right eye only. Put it in. Oh, this is much better. I said, how's your distance? Oh, it's good. He said, it's not, you know, da, da, da. I said, okay, let's check your near again. He said, well, it's not as sharp as the other one. He said, but I can read it. I said, you may have to find your sweet spot. I said, but that's normal. I said, but is it good? Can you read? He said, yes. I said, pull out your phone. Check your phone. How is your phone? He said, oh, it's good. I said, are you on the computer a lot? He said, yes. I said, come over here. Let's check the computer. Find your computer range. He said, okay, this is good. He said, my monitors are much bigger, so I think I should be good. I said, okay, okay. I said, we got somewhere. I said, how you feel about this? He said, I feel good. He said, thank you so much for your patience. I said, you're so very welcome, sir. I said, listen, this is what we're going to do. This is the plan. And this is how I'm talking to him, y'all, for real. I said, friend, this is what we're going to do. This is the plan. And I'm smiling while I'm doing this. I said, I want you to wear this contact for about a week. Of course, take it out every night, clean it. I gave him all the cleaning solution, everything. I went over everything thoroughly. I said, wear about a week. Let's see how you do. Go out in the real world and see how everything looks to you, okay? I said, and you give me a call so that we can finalize it. I said, I really think you're seeing great with this prescription that I've given you today. So I think you'll be fine, but just go out and see how it looks for you. He said, okay, I can do that. He said, thank you so much for your time and your patience. He said, I know I could be a little difficult. I said, that's okay. I said, you fine. You fine. I'm telling y'all, the most difficult patient ever.